Hi guys, welcome to Plasma. So today we are going to discuss neurotransmitter chemistry of the autonomic nervous system. On the basis of primary neurotransmitter release, nerve fibers that release acetylcholine are known as cholinergic and nerve fibers that release noradrenaline are known as adrenergic. Okay, so this is cholinergic transmission. First, choline is transported into the nerve terminal with the help of sodium dependent choline transporter. Then in the cytoplasm, acetyl coenzyme A combines with choline to form acetylcholine in the presence of enzyme choline acetyl transferase. This acetylcholine is transported into the synaptic vesicle with the help of vesicle associated transporter. This can be blocked by vasamicol. In the synaptic vesicle, acid ATP and proteoglycan are present. Now, as the calcium channel opens, there is calcium influx which leads to neurotransmitter release in the form of exocytotic vesicle. Now, this is the postsynaptic cell. These are cholinereceptors, and excess of acetylcholine is converted into choline plus acetate by the enzyme acetylcholine esterase, right? And this step is blocked by the release is blocked by botulinum toxin. This is adrenergic transmission. So tyrosine is transported into the nerve terminal with the help of sodium dependent transporter, and tyrosine is converted to dopamine. These are the steps. So tyrosine is converted to dopa first with the help of enzyme tyrosine hydroxylase, which is blocked by metyrosine. Dopa in the presence of dopa decarboxylase is converted to dopamine. This dopamine is converted to norepinephrine in the presence of enzyme dopamine beta hydroxylase. This norepinephrine is converted to epinephrine with the help of enzyme phenylethanolamine N-methyltransferase. Now, this dopamine here is transported into the synaptic vesicle by vesicle monoamine transporter. Okay. Then, as the calcium channel opens, similarly, there is exocytotic release of the neurotransmitter norepinephrine. This step is blocked by beryllium and guanthidine. Now these are adrenoreceptors. Norepinephrine diffuses and excess is taken back by norepinephrine transporter. This transporter is blocked by cocaine and tricyclic antidepressants. Now we'll discuss the major autonomic receptor types. Okay. So first we'll discuss the cholinereceptors. They are divided into muscarinic and nicotinic. Okay. In muscarinic we have M1, M2, M3, M4 and M5. Nicotinic we have NN and NM, right? So muscarinic are G protein coupled receptors and nicotinic are ligand gated ionic receptors. This is a typical muscarinic receptor. Okay, it's also known as a serpentine receptor because of its 7 domains. This is a nicotinic receptor. It's composed of 2 alpha plus 1 beta plus a gamma plus delta subunit, right? So in cholinereceptors, we'll discuss about the M1. So M1 is present in CNS neurons, right? Sympathetic postganglionic neurons and some presynaptic sites. Okay. Now it's result of ligand binding, formation of IP3, that is inositol triphosphate, and diacylglycerol, and increase intracellular calcium, right? Now the M2 is present in myocardium, smooth muscle, some presynaptic sites, CNS neurons. Okay, its result of ligand binding is that it opens potassium channels and inhibition of adenyl cyclase, right? The M3 receptor is present in exocrine glands, vessels, that is smooth muscle, and endothelium, and CNS neurons. So its result of ligand binding is similar to M1 receptor, that is formation of IP3, diacylglycerol, and increased calcium. Okay. Now we'll discuss the M4 receptor. It's present in CNS neurons and possibly in vagal nerve endings. Its result of ligand binding is that same of M2 receptor, that is opening of potassium channels, inhibition of adenyl cyclase. The M5 receptor is present in vascular endothelium, especially in cerebral vessels, CNS neurons. So its result of ligand binding is same as M1 receptor, that is formation of IP3, diacylglycerol, and increased intracellular calcium. Now nicotinic receptors, nicotinic N receptors, they are present in postganglionic neurons, some presynaptic cholinergic terminals, right? The result of ligand binding is opening of sodium and potassium channels and depolarization. Right? Now, nicotinic and M receptors, their location is in skeletal muscle, neuromuscular end plates. Okay. Their result of ligand binding is opening of sodium and potassium channels and depolarization. Right? Now we come to adrenoceptors. Okay. So they're alpha 1, alpha 2, beta 1, beta 2, and beta 3, and dopamine receptors, which are D1, D2, D3, D4, and D5. Right? So we'll discuss them individually. The alpha 1 is present in postsynaptic effector cells. Smooth muscle. Right? Its result of ligand binding is formation of IP3, diacylglycerol, and increase intracellular calcium. Right? Now we'll discuss the alpha 2 receptor. It's present in presynaptic, adrenergic nerve terminals, platelets, it's very important, and lipocytes and smooth muscle. Right? Now its effect of result of ligand binding is that inhibition of adenyl cyclase and decrease CAMP. Okay. Now we'll discuss the beta 1 receptor. The beta 1 is present in postsynaptic effector cells, especially heart, right? Lipocytes, brain, presynaptic adrenergic and cholinergic nerve terminals, and this is important, GAG apparatus of renal tubules and ciliary body epithelium. Right? Now its effect of ligand binding, right? It's stimulation of adenyl cyclase and increase CAMP, and it activates cardiac GI under some conditions. Okay. Next is the beta 2 receptor. So it's present in postsynaptic effector cells, smooth muscle plus cardiac. Its effect of result of ligand binding, stimulation of adenyl cyclase, okay, increased CAMP, beta 3 receptor, postsynaptic effector cells, present in lipocytes. Its effect of result of ligand binding is that it stimulates adenyl cyclase and increase CAMP, right? Now the dopamine receptors. So we'll talk about D1, that is known as DA1, and the D5 simultaneously. So it's present in brain effector tissues and smooth muscle of renal vascular bed. Its effect is stimulation of adenyl cyclase and increased CAMP. D2 is known as DA2, present in brain effector tissues like smooth muscle and presynaptic nerve terminals. Its result of ligand binding is that it inhibits adenyl cyclase and increase potassium conductance, right? Now the D3 is present in brain, so it inhibits adenyl cyclase, and D4 is present in brain plus cardiovascular system. This also inhibits adenyl cyclase, right? So thank you.